Jakarta has yet again extended the transitional phase, this time until September the 10th, before it eases remaining COVID-19 restrictions. The Indonesian capital remains the epicenter of the country's pandemic, with large areas of the city classified as red zones or high-risk areas. More than 37,000 COVID-19 cases have been recorded in Jakarta, with nearly 5,000 people in self-isolation at home. Saiful Ismail visits one of these red zones and finds out how the neighborhood is coping.
Maun contracted COVID-19 last month. As he had no underlying medical conditions, he was placed on home quarantine. The 48-year-old isolated himself in a room on the second floor and avoided contact with the rest of his family. After more than a month, the father of 2 children was finally cleared of the disease.
Saya merasa kalau isolasi mandiri itu lebih dekat dengan keluarga ya. Saya masih dengar anak-anak suaranya gitu. Kalau di rumah sakit saya nggak bayang ada berapa dokter, ada berapa perawat yang harus menangani itu gitu.
Maun is not the only COVID-19 patient in his neighborhood. So far, 10 residents have been infected by the virus and ordered to quarantine at home. This neighborhood in Muncul Village, East Jakarta, has more than 5,000 residents and is a COVID-19 red zone. Presently, there are 3 positive cases and they are all isolating themselves in their own homes. Local leaders have set up a task force to educate residents on how they can live together with COVID-19 patients. At first, residents living near these patients were concerned.
Awalnya memang sedikit khawatir, takut, karena kebetulan rumah saya dengan yang kena COVID itu kan nempel temboknya. Kemudian jalannya juga sama gitu, jalannya. Tapi setelah diedukasi oleh dokter puskesmas, oleh Pak RW, itu kita tidak khawatir sama sekali karena yang kena COVID dan keluarganya itu disiplin orangnya.
Now neighbors are no longer staying away. They are chipping in to offer support to COVID-19 patients and their families. And humanitarian organizations like the Indonesian Red Cross are also providing help by disinfecting homes and other common areas.
Karena permintaan yang meningkat dan juga kami juga sumber daya juga terbatas, kami harus memilah mana yang paling utama yang harus kami penuhi. Yang sekarang yang paling utama adalah wilayah-wilayah yang red zone dalam masuk ke zona merah, di mana zona merah tersebut sudah ada orang atau kasus konfirmasi positif.
Authorities conduct an assessment of COVID-19 risk areas every week. East Jakarta is one of 17 districts in Indonesia that have been reclassified from a moderate to a high-risk area as the rate of COVID-19 transmission increases.
Kami mohon agar perhatian kepada 17 kabupaten kota ini untuk segera dapat meningkatkan penanganan kasus dan penyelidikan epidemiologi serta testingnya dengan baik agar posisi risikonya bisa menurun kembali menjadi sedang atau rendah.
COVID-19 has infected all districts in Jakarta and communities continue to adhere to health protocols to limit the spread of the virus. With no end in sight and until a vaccine is ready, residents have little choice but to learn to live with the disease. Saiful Ismail, CNA, Jakarta.